Hello everyone. Today we'll be talking about anatomy and physiology of heart. So in this presentation, I'll be talking about the structure and position of the heart, various layers of the heart, chambers of heart, heart valves, conduction system, blood supply and the drainage, and pathway of blood in the heart. So starting with the structure and position of heart, heart is a hollow muscular organ and it is larger than a closed fist. When we talk about the shape of the heart, it is pyramidal in shape. It has apex and it has the base. The apex of the heart lies towards the lower side and the base of the heart lies towards the upper side. When we talk about the position, it lies anterior to the vertebral column and posterior to the sternum, and it has four chambers. They are right and left atria and right and left ventricles, and a third of the heart lies to the right of median plane, whereas two-thirds lies to the left. Therefore, we say that heart lies towards the left side of the body. When we talk about the layers of heart, it is encased in a fibrous sac known as pericardium. Peri means surrounding and cardium means heart. So it has been surrounded by a fibrous sac. The name of that sac is pericardium, and you have two layers of pericardium. They are fibrous pericardium and the serous pericardium. The serous pericardium is again has two layers, that is parietal pericardium and visceral pericardium. So basically visceral pericardium is also known as epicardium, and then you have myocardium and endocardium. So if somebody is asking you which all are the layers of the heart, the answer is heart has three layers, that is endocardium, myocardium, epicardium, and it is encased in a sac, and the name of that sac is pericardium. The layers of pericardium are fibrous pericardium and serous pericardium. So we can also see the same in this picture, where if we start from the inward, you have the heart chamber here, then you have the innermost layer known as endocardium, then you have the muscular layer known as the myocardium, then you have the outermost layer, which is the epicardium, also known as the visceral layer of serous pericardium. And then we have here the parietal layer of serous pericardium. You can see here between the visceral layer and the parietal layer, there is a space known as pericardial cavity. So we can also see the same in this picture in an enlarged view, that you have a pericardial cavity which is between the visceral and parietal pericardium. So basically this pericardial cavity has fluid known as pericardial fluid, and the normal amount of that fluid is 10 to 50 ml. So the next part is heart chambers. So basically heart has four chambers, two towards the right side and two towards the left side. So on the right side, we have right atrium, we have right ventricle. On the left side, we have left atrium and we have left ventricle. Remember, on the right side of the heart, we have the deoxygenated blood, and on the left side of the heart, we have the oxygenated blood. Then these chambers are being divided with the help of valves and the septum, atrioventricular septums. When we talk about the valve, we have four types of valves, or we have four valves, you can say. That is, we have tricuspid valve and we have mitral valve. Then we also have pulmonary valve and we have aortic valve. Remember, tricuspid valve and the mitral valve are known as atrioventricular valve. Why? Because they lies between the atria and the ventricles. The atria को ventricles से differentiate करते हैं. So they are known as atrioventricular valve. And you have two more valve, that is your aortic valve and the pulmonary valve. They are known as semi-lunar valves. Okay, so when we see here tricuspid valve, it lies between the right atrium and right ventricle. When we talk about the mitral valve, it lies between the left atrium and the left ventricle. When we talk about the pulmonary valve, It separates the right ventricle with the pulmonary artery. And when we talk about the aortic valve, it separates the aorta with the left atrium. So these are the heart valves. You can also see here in this picture about the cusp of these valves. Okay, so here we can see this valve has three cusps. It means it has one cusp here, and one here. So it is known as a tricuspid valve. Tri means three, and the valve which has three cusps is tricuspid valve. Here we can see this valve where you have one cusp here and the other one there. So it is known as bicuspid valve. So remember, mitral valve is also known as bicuspid valve. And then you have two semilunar valves here, which is your aortic and the pulmonary valve. And they also have three cusp. Here you can see the aortic valve has 1, 2, 3 cusp, and here the pulmonary valve also has 1, 2, and 3 cusp. Okay. The next part is about the movement or pumping action of the heart. So we know that heart is the organ which keeps on pumping and moving the blood from one for it keeps on moving the blood to different body parts, and also the lungs for the oxygenation. So how it is possible for the heart to keep pumping? It is because of the conduction system. So we have the heart has its own conduction system which helps in the pumping action of the heart so that the heart is able to perform its function. So when we talk about the conduction system of the heart, it starts with the sinus node, which is also known as SA node or sinoatrial node. So the impulse, it is also known as the pacemaker of the heart, which starts where the impulses start to form. Afterwards, the impulses move from the SA node to the AV node, and in between also you have various internodal pathways. After the impulse has reached to the AV node, that is atrioventricular node, it moved towards the AV bundle, also known as bundle of His, where it differentiates into two branches, that is left bundle branch and the right bundle branch, and then it again differentiates into Purkinje's fibers. Okay, so when we talk about the conduction system of the heart, it starts with the SA node, then we have AV node, then we have bundle of His, then we have left and right bundle branches, and at the end we have the Purkinje fibers. Next one is coronary artery. So we know that heart is the organ which supplies blood to each and every body part, but for its functioning it also needs the blood supply. So the blood vessels which supply the oxygenated blood to the heart are known as coronary arteries. So here we can see the picture of coronary arteries. You might have heard about a disease known as कोरोनरी आर्टरी डिजीज, जहां पे क्या होता है, आर्टरीज में डिजीज हो जाता है. We'll talk about that in later presentations. First of all, focus on the coronary artery. So broadly we have two main coronary artery, that is left coronary artery and the right coronary artery. The left coronary artery has its own branches, like it has the left anterior descending artery, then it has circumflex artery, then it has the marginal artery and the diagonal arteries. And when we talk about the right coronary artery, it has right marginal artery and posterior descending artery. So these are the further bifurcations of right and left coronary arteries which supply the oxygenated blood to the heart. Then afterwards, the coronary veins also form, which carries the deoxygenated blood. So we have different coronary veins known as middle cardiac vein, small cardiac vein, and great cardiac vein. Those middle, small, and great cardiac vein forms the coronary sinus, which again opens or drains in the right atrium, where the blood will be moved towards the lungs for the oxygenation. So this is about the coronary sinus. So in a nutshell, when we talk about the heart, we have seen that it is the hollow muscular organ which keeps on pumping the blood to the lungs for the oxygenation, and also to different body parts for providing the oxygen as well as the blood supply to all the body parts. So what happens, the deoxygenated blood from the superior vena cava and the inferior vena cava and the coronary sinus passes, drain their blood in the right atrium. Afterwards, the blood moves through the tricuspid valve to the left, to the right ventricle, and from where it moves to the pulmonary artery to the lungs. In the lungs, the oxygenation, ventilation, perfusion takes place, and afterwards the oxygenated blood is returned back to the left side of the heart, or we can say the left atrium, through 4 pulmonary veins. And afterwards the blood moves from the left atrium to the left ventricle through the bicuspid valve or through the mitral valve, and then it moves to the aorta, and then the aorta supplies, different portions of the aorta supplies different parts of the body. And everything is possible, this pumping is possible because of the conduction system of the heart, which starts at the level of SA node. So next we'll be talking about the pathway of blood in the heart. Broadly we'll be discussing about it. So what happens, you know that every body parts, they need oxygenation, they need blood supply, they need nutrition. That is possible with the help of the blood circulation, isn't it? So afterwards the deoxygenated blood is carried by the 2 main vessels, that is from the lower portion, inferior vena cava, and from the upper portion, the superior vena cava. And those both of these vena cavas will be draining in the right atrium. Along with these 2 vena cavas, the coronary vein also will be draining in the form of coronary sinus. We discuss about that. It will be draining in the right atrium, and afterwards the blood will move towards the right ventricle with the help of, like, when the tricuspid valve is open, and afterwards from the right ventricle the deoxygenated blood will go towards the pulmonary artery, right and left pulmonary arteries, with the for the oxygenation in the lungs. In the lungs the oxygenation will take place, and then the oxygenated blood will be moved from the right and left. You have 4 pulmonary veins which will be giving the oxygenated blood, which will be draining the oxygenated blood inside the left atrium, jahan se kya hoga, mitral valve ke through oxygenated blood will will move from left atrium to the left ventricle, and through the aorta it will move towards the whole body parts, through the in the upper body also, in the lower body also. Every body part will be getting the oxygenated blood flow. So that is the pathway of blood in the heart. So that's it about the anatomy and physiology of heart. Today we have talked about position of the heart, structure of the heart, layers of the heart, where we have like epicardium, myocardium, we have endocardium. Then we talked about the chambers of the heart, where you have right atrium, right ventricle, left atrium, left ventricle. Then we talked about the valves of the heart, where we have semilunar valves and the atrioventricular valves. Then we talked about the conduction system, blood supply and drainage through coronary arteries and coronary veins. And then we also talked about the pathway of blood in the heart. So I have a question for you people. In the comment box, you have to label the parts which has been depicted in this picture, like what represents A, what represents B, what represents C, and what represents D. So that's it for today. Thank you so much.